February is Heart Month, and every Wednesday this month, we're bringing in the heart health experts from the Secours Heart and Vascular Institute to talk about preventing heart disease. Joining us today to talk about one treatment to keep your heart healthy is cardiologist Jun Chung. Dr. Chung, welcome to the Hampton Road Show.
Glad to be here.
We are talking today about cardiac catheterization. What is it and why is it used?
Cardiac catheterization is a procedure that you perform to look at the arteries that surround the blood vessels, the arteries that surround the heart, the blood vessels that surround the heart. And the most common reason for doing that procedure is if patients have chest pains or heart attack. The blood vessels that surround the heart cause, if you don't get the blood, then it causes damage to your heart.
So you're going in, inspecting, looking to see exactly what's going on.
That's correct.
Diagnostic tool that's used in so many different other ways?
Yeah, it's an angiogram, essentially. You look at the blood vessels by injecting dye into them.
What is the difference between the radical artery catheterization? How's it different from that in traditional cardiac catheterization?
So the radial artery is the artery that most people check their pulses on their wrist. And the artery in your arm or in your wrist is much smaller than the traditional artery that we use, which is a femoral artery, which is in your leg, near your groin. The artery that's in your leg, typically in a man, is about the size of your little pinky. The size of the artery that's in a man in your wrist is about the size of a wire. So if you were to take a tube and try to put it into those arteries, your options are limited going through the wrist because it's a much smaller artery, whereas your options are more wide open if you go through the groin. The other issue is that when you go through the groin, through the leg, it's a more straight shot. Bigger vessels, less turns. If you go through the artery in your wrist, you have to take a lot of turns.
For anyone out there who is a patient, what can they expect if they have to go through this procedure? Is it painful? Is it, how difficult is it for the patient?
You know, it's a lot easier for the patients that they think. You know, we probably do, I mean, our hospital does probably thousands a year. The most difficult part for the patient, there's two components. Number one is the actual pain of going through the process. So once you numb up the area that you're going in through, that's usually pretty well taken care of. The second part that patients mostly complain about is the fact that they have to lay in bed for hours after the procedure. Now, if you go through the wrist, you can just sit up right away. If you go through the groin, you have to lay in bed anywhere from 1 to 6 hours afterwards.
So the patient is awake the entire time?
It's like going to a dentist, but less painful.
But the benefits are tremendous. I mean, you guys can learn a lot, and you can help save lives through this procedure.
That's correct. It is a definitive diagnosis. For instance, if you go through a stress test or a CT scan or things like that, you can sort of see where the blockages may be. But if you go through this procedure with the angiogram, you see definitively where the blockages are. The second component is what you were talking about, which is to actually treat it. Obviously, we don't have the technology to treat it, and going through a CT scan or a stress test. We actually have to get the balloons, the wires, and stents to that location. And the only way to do that is to use the tubes like a tunnel in a mine and use a rail. So unless you do that procedure, we don't yet have a way to fix the blockages without going through the artery.
Great advice, Dr. Chung. Thank you for helping save lives on a daily basis, and keep up the good work. For more information, go to Secours Heart and Vascular Institute. You can give them a call at 757-889-CARE, or you can look it up online at bshr.com. Dr. Chung, thank you so much for joining us today on the Hampton Road Show.
Thank you.